Welcome everyone. I'm excited to kick off our presentation today. This is episode 7, the first slide, our cover slide. Today, we'll be exploring some fascinating topics. We'll start by introducing the main theme and what you can expect to learn. So, let's get started and dive into what makes this episode special. Let's consider a scenario where a female client is taking cascara sagrada. As nurses, it's important to inform our patients about potential side effects they might experience. Cascara sagrada is a natural laxative, but like any medication, it can have adverse effects. One of the key side effects to be aware of is gastrointestinal bleeding, which can occur if the bowel is irritated or damaged. We also need to watch out for peptic ulcer disease, since the medication can increase stomach acid or irritate the lining, leading to ulcers. Another common side effect is abdominal cramps, which many patients may notice as discomfort or pain in the stomach area. It's also crucial to be alert for signs of partial bowel obstruction, especially if the client experiences symptoms like severe cramping, nausea, or vomiting, as this is more serious and requires immediate attention. Overall, when discussing medications like cascara sagrada, our goal is to educate clients about both the benefits and potential risks, ensuring they understand what to monitor for and when to seek help. Abdominal cramps are a common symptom that many people experience. They can be caused by a variety of factors, such as digestive issues, infections, or even stress. When discussing abdominal cramps, it's important to understand that they often signal that something is amiss within the digestive system. These cramps can range from mild discomfort to severe pain, and their location can give us clues about their cause. For example, cramps in the lower abdomen might be linked to issues with the intestines or reproductive organs, while upper abdominal cramps could relate to the stomach or liver. Recognizing the characteristics of these cramps, like their frequency, duration, and any accompanying symptoms, helps in determining whether they require medical attention or can be managed at home. In the context of overall health, persistent or severe abdominal cramps should never be ignored. They can indicate underlying conditions that need proper diagnosis and treatment. So, understanding the nature of abdominal cramps is a key part of managing health effectively and recognizing when it's time to seek professional help. Cascara sagrada is a natural stimulant laxative that comes from the bark of a specific plant. It has been used for centuries to help with constipation. The way it works is by stimulating the muscles in the intestines, which is called peristalsis. This action helps to move the stool more quickly through the digestive tract. Essentially, cascara sagrada increases bowel movements, making it effective for relieving occasional constipation. It's important to understand how these natural remedies can support digestive health, especially when used appropriately within a broader treatment plan. Let's take a closer look at some common side effects of cascara sagrada. One of the most noticeable is abdominal cramps, which many people experience after use. These cramps can be quite uncomfortable, so it's important to be aware of them. Diarrhea is another common issue, and it often occurs because cascara sagrada stimulates bowel movements. While this might seem helpful initially, prolonged use can lead to more serious concerns. Speaking of which, electrolyte imbalance is a significant risk, especially with long-term use. When the body loses too many electrolytes through frequent diarrhea, it can cause issues like weakness, dizziness, or even more serious health problems. We also need to keep in mind that dependence can develop if cascara sagrada is used regularly over a long period. The bowel muscles can become reliant on the stimulant, making natural bowel movements more difficult when you stop. So, while cascara sagrada can be effective for short-term relief, these side effects highlight the importance of using it cautiously and under medical supervision. Let's clarify some common misconceptions here. First, gastrointestinal bleeding is not a typical side effect of cascara sagrada. While it's a powerful laxative, it doesn't usually cause bleeding. Next, regarding peptic ulcer disease, cascara does not cause ulcers. It mainly acts as a stimulant laxative and isn't linked to ulcer formation. Lastly, partial bowel obstruction is a serious condition, and laxatives are actually contraindicated if an obstruction is present. However, it's important to note that laxatives don't cause the obstruction. They're simply not safe to use when an obstruction exists. Understanding these distinctions helps us better evaluate the safety profile of cascara and avoid misconceptions. Stimulant laxatives are known to commonly cause cramping, and that's primarily because they increase intestinal activity. When the bowel is stimulated more than usual, it can lead to those uncomfortable cramping sensations. It's important to inform clients about this expected effect so they're not surprised or alarmed if it happens. As nurses, we need to educate our patients on what to expect when they're using these medications. Understanding that cramping is a normal response can help them manage any discomfort better and encourage adherence to the treatment plan. Also, keep in mind that while stimulant laxatives are effective, their tendency to cause cramping highlights the importance of using them appropriately and monitoring for adverse effects. Connecting this to our overall goal, ensuring safe and effective bowel management, is key. We want to support our clients in using these medications correctly while being aware of and prepared for common side effects like cramping.